CPHQ Exam Review Certified Professional in Healthcare Quality, 35 Hardest Questions. Question 1. What is the primary purpose of a root cause analysis, RCA? Punish errors. Identify system failures. Assign blame. Document the event. RCA is a retrospective tool focused on systems, not individuals. Question 2. Which chart is best for showing the 80/20 rule? Control chart, Pareto chart, fishbone diagram, run chart. A Pareto chart identifies the vital few problems, 80% of issues from 20% of causes. Question 3. What does Six Sigma focus on reducing? Waste, cost, variation, time. Six Sigma aims to minimize variation and defects. Question 4. In lean methodology, MUTA refers to value, waste, flow, speed. MUTA is the Japanese term for waste. Question 5. The PDSA cycle stands for Plan Do See Act, Perform Data Study Act, Plan Do Study Act, Prioritize Do Study Act. Plan Do Study Act is the standard improvement cycle. Question 6. A sentinel event is defined by which organization? CMS, FDA, the Joint Commission, CDC. The Joint Commission defines and tracks sentinel events. Question 7. The best way to display data over time is a bar graph, run chart, pie chart, histogram. Run charts and control charts show trends over time. Question 8. What is the numerator in a quality measure? The total population, the group being measured for the outcome, the excluded group, the benchmark. The numerator represents the number of cases meeting the criteria. Question 9. Reliability in healthcare systems refers to profitability, failure-free operation over time, staff satisfaction, patient volume. Reliability is the ability of a process to perform its function consistently. Question 10. Benchmarking is the process of setting high prices, comparing performance to best practices, creating new laws, firing underperformers. Benchmarking involves comparing outcomes against industry leaders. Question 11. Who is considered the father of quality in healthcare? Structure/process/outcome. Deming, Huron, Donabadian, Crosby. Avides Donabadian developed the structure-process-outcome framework. Question 12. A fishbone, Ishikawa, diagram is used for data analysis, brainstorming root causes, project scheduling, cost-benefit analysis. It is a cause and effect diagram used in brainstorming. Question 13. What is the standard confidence interval often used in research? 80%, 90%, 95%, 99%. 95% is the most common confidence interval in healthcare research. Question 14. Credentialing is the process of paying doctors, verifying a practitioner's qualifications, marketing services, training staff. Credentialing ensures practitioners are qualified to provide care. Question 15. A culture of safety is characterized by blaming individuals, reporting errors without fear of retribution, strict hierarchies, hidden data. Safety culture encourages transparency and system-based learning. Question 16. What is a type I error in a quality study? Missing a true difference, finding a difference where none exists, small sample size, bad data entry. Type I, alpha, is a false positive, concluding there's an effect when there isn't. Question 17. The primary focus of COPS is financial auditing, patient experience/satisfaction, clinical outcomes, surgical safety. COPS is a standardized survey for patient perspectives of hospital care. Question 18. Risk management primarily aims to lower staff wages, minimize financial and legal liability, increase advertising, ignore errors. Risk management protects the organization's assets and reputation. Question 19. What is process mapping? A GPS tool, visual representation of workflow steps, a list of employees, a financial report. Process mapping visualizes the sequence of events in a process. Question 20. In a normal distribution, what percent of data falls within one standard deviation? 50%, 68%, 95%, 99%. 68% of data falls within one SD in a bell curve.